On behalf of NAMI, Yavapai, and Northern Arizona Peer and Family Coalition, welcome. Our presenter, well, our topic today is what to do after a mental health crisis. And our presenter is Dawn Mcreynolds. Dawn is originally from Detroit, Michigan, where she transitioned from working for a nonprofit organization to founding one in 2003. She brings her personal experience and deep understanding of receiving services in the behavioral health system as a member to all she does. Dawn leads the United Healthcare Community Plans OIFA, which stands for Office of Individual and Family Affairs team. The OIFA team works collaboratively with lived experience members and family members to gather the voice and experience of our community in order to enhance, improve, and remove barriers to service all those we serve. So with that, I will turn it over to Dawn, and thank you, Dawn, for being here and providing us this presentation.
You're welcome, and thank you. And hi, everybody. Just briefly, I want to tell a little bit of my story above and beyond being an individual that has gone through the behavioral health system and still is in mental health recovery. I'm also a family member, and I have a daughter that is 35 that receives services within the behavioral health system and also has unique and special challenges. And I'm Italian. And the reason that I'm telling you that is I am fluent in sign language, and being Italian, my hands often move with my expressions. And so please don't let that distract you. My hands definitely help me express what I'm trying to say. Let's get into it. And as Candy indicated, we'll be discussing a crisis aftercare. And so if you have a question or a comment, I love interaction when I am presenting. So I definitely want to be able to interact with everybody on this call. So if you'd like to, just take yourself off mute and let's talk. Again, I am the administrator of the Office of Individual and Family Affairs. I have been working in this industry for over 35 years now. My daughter was just a baby when I started in this industry. I myself have experienced crisis, and I've experienced it with my daughter all the way up until just last month. So this is a subject that's very near and dear to my heart. So I don't read off of slides. I just like to have a conversation. And one of the worst experiences is to be an individual or a family member in the midst of a crisis. From an individual's point of view, there is nothing more scary than feeling that everybody around you feels that you may be out of control, but you cannot see that. You necessarily cannot look in the mirror in the midst of a crisis. And also, if you have been put into situations as an individual where you needed more support or help, there may be a mistrust factor that increases during a crisis. Sometimes we see paranoia type behavior or aggressive behavior during a crisis. And as a family member, we're doing the best that we can and what we believe is so important for our loved ones. So it's a very difficult time. It can be very confusing. And to be connected to your OIFA support within your health plans is one of those gifts that you can utilize to find, even if it's just a conversation to support you during those challenging times. Most OIFA offices throughout the state have what we call adult member liaisons and children and family member liaisons. And those individuals work diligently to not only support the individual that's going through that crisis, but also support those individuals that um, are supporting their loved ones, whether that's, a family member, a family of choice, a neighbor who's invested in that process. That's one of the most important things that OIFA does. And so I always talk about 3 steps to take when you're first experiencing a crisis with a loved one. And if your loved one is not able to follow these steps, of course, that falls to us as family members. So if you have guardianship or you're their voice with their physician, you definitely want to ensure that you follow up with their care team, their doctors, if they have unique and special challenges. They may have a DDD support coordinator. They may actually have a care manager or a case manager within the home or the clinic that they receive services for. Now, this is where I get real. Um, sometimes you feel when you call and report these type of situations that maybe you don't hear anything back. Maybe you feel like nobody's really listening or making a change. That's okay. Keep reporting what is going on and keep a record of what you have reported. And part of the reason is that that voice needs to be on record somewhere if something should occur in the future. If you need to, let's say, file a complaint or a grievance, a quality of care concern, that record will help you be able to track the amount of communication that goes back and forth between yourself or the individual and those that are supporting that person's journey. Of course, I know that there is feedback within the community that there is fear about filing complaints or grievances against agencies that support your loved ones or yourself. And for the record, anybody can file a complaint or a grievance. I was on a CFT last week, um, and I ended up filing a quality of concern on behalf of the member. So, as OIFAs in your health plans, we are able to support the members. So, if the family is afraid of filing a grievance or a complaint, I always recommend that you reach out to your OIFAs to see what can be done to support you during that process. Although we love to see families and individuals picking up their rights and their tools and getting proactive, if there's a fear, we also support you through that process. Now, the reason that I'm saying reach out and document these situations is because it also teaches you something very key. And I'll tell a story to help you understand my point. My daughter, prior to an actual crisis moment, has certain behaviors, and they start out very benign. They may be wanting to have a lot of communication with me. Can you visit for 5 minutes? Can I talk to you several times during a day? I've learned that um, that and also going to the refrigerator and eating a large amount of food are 2 of the signs that I can tell something is not quite right. Something is going on, and I might need to sit with her and have a conversation or pull in a professional to help to prevent those next steps in what can occur in a crisis after. The only way that I know those things is through several crisis situations and writing that information down of what happened during the crisis, and then kind of reflecting back on what occurred prior to the crisis. So my advice is always just to write some information down, some basic information down. Has anybody done that on this call?
Are you talking about you see behaviors, you see something's up, and then you start planning with talking, trying to start a conversation, what's going on with the excessive, for one person, it might be food behavior. For another person, it might be an excessive behavior. So the pre-planning, I did experience some frustration with that with my son, in that I pre-planned actual excellent help for him. And yet, being the parent of an adult son
Yep.
is different, because he was married. And so I was unable to get his wife on board with some excellent help. And then later she was saying, oh yeah, now I'm seeing it. But then it escalated extremely fast after that. And then the planned help was no longer needed because there was a crisis and everything just went boom.
Yep.
It was just so I experienced that frustration with the pre-planning stage of my son not getting the help he needed, because there was, some denial going on. There was definitely they weren't able to step up to
Right.
what I could see, but they couldn't see it. So
It's so frustrating
Yeah.
when you have a team of individuals in your loved one's life, and not
Yeah.
everybody can get on that same page in the time that you need them to get on that same page. And the gift is that finally she got on that page with you, and now is when you can sit down and create your own personal family crisis plan. When everything's calm, when everything's okay, then that's when the individuals that support their loved one can come together and say, okay, next time I see this or you see this, we need to talk to him about this. And it's best to always, and I don't know if you've done this, Susie, I'm assuming that you have, but it's always best to kind of write those, who's going to be responsible for calling, Susie if he's at home with his wife and she starts seeing this, or vice versa. And and then I think one of the scariest things that I say to families who have loved ones is, and then there needs to be a conversation with the loved one.
Yes.
And so there is no paranoia or no big surprises. And
Yes.
it can be very matter of fact, very simple. It doesn't have to be, I mean,
Yeah.
I've had families that invite the aunts and the uncles and, everybody, and then there's this big, huge, family surrounding this one individual, and everybody's talking about this one individual. And I don't like that myself.
Yeah.
So, just a real simple, hey, when I see this going on, I just want you to know I have to call for help because it scares me.
Yeah.
And the more vulnerable we can be with that. But that's a great, Susie, I love that story, because this is what happens as a
Yes.
family.
Yes.
It's I know this isn't right. And then, maybe by the time others kind of, get involved, it feels like it's too late.
Right. Yeah. Uh-huh.
But knowing the signs is one of the most important pieces. And if you're a family member,
Mhm.
trust yourself. You are the subject matter expert on your loved one, and trust the signs that you're seeing.
Mhm.
Often families are so frustrated because my daughter's an adult. As I said, she's 35. And unless I take over complete guardianship of her, which she's not at that point, but unless I do, then I can't force anything to happen, right?
Yes. Yes.
Uh, so, okay, was there anybody else that wanted to comment on that one piece that we were talking about?
I was just going to mention that I, as a neighbor, called on behalf of my neighbor and talked to the care manager, and that was extremely successful. And the other thing is, I do write my son's care manager and take it to the office and submit it in writing so that it's part of the permanent record.
Beautiful. Well, Miss Candy.
Mhm.
Yes. And so that's what I was talking about when I said, as a loved one, a family member, a family of choice, or even a neighbor, sometimes we do not realize that some of our best allies live right next door to us. And so we don't know where they've been necessarily, or maybe we know, but maybe we don't know that we can actually be vulnerable and open ourselves up and expand our support circle. I just outreached Candy this morning and said, I really need to expand my support circle, can I call you? So we all need each other. And I think back in the day when I was living in Detroit, I very few of us had like fences around our houses, and so there were just open yards, and we had a real sense of community. We had barbecues where next thing you know, our neighbor was pulling out their barbecue, and then two doors down, and the kids were all running with each other, and it was a wonderful experience growing up in that neighborhood. And when I first moved out to Arizona, I landed in Chandler, and there were walls all around the houses, and I had never seen that in my life. And I thought, oh my gosh, that it was just alarming to me. I wonder how the community grows and thrives, in this environment. And so we as family, not only do we need each other, but that record again of knowing the signs, notifying everybody, those are some key steps, and they're not always easy. Some stories that I've heard is family is really not listened to in some of the providers, and that's one of the biggest education pieces when I'm looking at working with a provider or talking with a provider. I speak about that family voice. We have to include our families in the discussion. If we don't, we're missing a huge part of the individual that we're trying to serve. So very, very important. And there are rules and, guidelines that providers have to follow, and ROIs and all of that. And so try to navigate that whole process as best you can. And if as a family member you do need support in that, I know that NAMI does a lot of family to family education, a lot of education on how to navigate those pieces and find the support that you need. Um, Part of the support too is going outside of the behavioral health system. And what I mean by that is there are so many community agencies that are getting with the program in the last couple years of starting to understand behavioral health, mental illness, substance use. And they are in our cities, in our small towns, and they provide things like clothing and food, and more than that, what individuals will find are those supports that they may need to be able to carry them, when money runs out, or to help pay utilities, or whatever the situation may be. But family members can connect to those organizations, and they can begin to work with those community organizations to make sure that those community organizations are aware that there's an entire community of families that support individuals that utilize their services, and families need support too. As if anyone on this call is an advocate, which I know, I mean, especially Lori and Candy, I know you both are, that is an advocacy piece that has been missing in our system, is going into the community agencies that provide services or physical supports, and learning who they are and making yourself known when you can, and also educating them. Use those moments of introduction to educate them on the role that family members play. Because you never know. I got a call from a community agency about a member that I was supporting, and they said, "Hey, so and so's in the store, and they want to take all the kittens in the cage home, and they just love them, and I can't have them actually removing the cage." Well, unbeknownst to the care managers that were working with this individual, they thought it would be a great idea to have this individual go and volunteer to help and support animals, because this individual just loved animals. Well, there was no further guidance or work with the individual once they got beyond the point of securing the volunteerism and learning how to take care of the animals. So, certainly, that individual grew to a place of loving these animals so much that the individual took ownership of the of the animals. I've been taking care of them for 60 days. They're my kittens. And so, we need to remember, as family members, community agencies are wonderful, and they could support our loved ones in volunteerism or physical support, or food donations and so on. But they also can play a role in the healing aspect of our families. So they can call us and they can say, "This is what's occurring," and give us time to work with that care team to be able to make some adjustments so that individual stays successful in what they're doing. So those are my top three
Yeah.
kind of steps. Yes.
Dawn, this is Lori. I want to go back to something you said before we got into community resources. And it was about if an ROI is in place or not, and the importance of family sharing information. And having worked as a crisis person, I can't emphasize how important it is for the family, even if there isn't an ROI, to provide information. And this is something that a lot of people aren't maybe aware of. You need an ROI to receive information, but
That's
you
right.
don't need one to give information. So it's always good to call or be a part of providing information, because your loved one isn't necessarily going to be forthcoming, and it can be very helpful in an assessment to help someone to see that their needs are met at the level that they require.
And ROI, I'm the acronym person, is release of information.
Yes, and here's a really important side note. I wasn't going to go into that too far, but thank you, Lori. That's important. But what our families encounter, and I'm always a rubber meets the road kind of person, is that they may call that agency, and that agency, in trying to protect that individual, will say, "This is what I hear all the time. I can't even talk to you. There's no RI." ROI. And that's the truth. That's what our families and our supportive loved ones face. And so the agency is trying to support the member and protect them. And we also don't know what policies or procedures are in place with every agency. Most important thing family members can do is follow what Lori's saying and say, I understand you cannot tell me anything, but I need to tell you something. Can you at least hear what I have to say and take some notes? If they say no, then elevate the call. I'd like to speak to somebody like your supervisor, or maybe they're just not aware that
And
they
Don,
can.
that's an important piece of the conversation. And when I take calls through the NAMI Yavapai phone or the Can We Help You on the resource page, I'm helping family members to understand the language is just what you said. You started by saying, I'm not looking for information. I know you can't give me information because there isn't an ROI, but I have information that will help you and help this person. So just letting them know that you're not looking for info and that you're aware that that is a part of how they do their business. Because technically they can't even say, acknowledge that a person's getting services. But if you start and say, I'm a family member, I know the care manager is so-and-so, or I'm a family member and I just need to get information to the crisis team, I'm not looking for information, to open
That's
that
correct.
door.
That's so correct. And so one of the most important moments that I had was an aha moment that aftercare actually begins as soon as the crisis starts. So we use the word after care as a placeholder of after the crisis calms down, and then we move forward with like treatment plans or next steps. But really, at that moment of crisis, that's when families are pulling out phone numbers. They're looking for the list of people that are, supporting the individual. They're finding out where they last got, X, Y, and Z service. And so what's really happening at that moment of crisis is that the family is trying to pull together all the pieces that can help them after the individual is experiencing that crisis. And that individual is most likely thinking, I don't want to go to the hospital. I don't want to go to the hospital. I'm going to say and do anything I can to not have to go to the hospital or not get medications changed or, whatever. So there's two different thinkings that are happening during that crisis. And in planning for a crisis, the planning for the next crisis occurs during the first crisis. Just like we heard Susie say, when her and her family member got onto the same page, things had already escalated to a point where the pre-intervention team couldn't come into play. It was a full-blown crisis. And so immediately during that crisis, that family, and it's hard, and I've been there. I'm just saying, it's extremely hard to think, okay, I need to plan for this next crisis. But that's when we need to start planning. That's when we start writing down that information of knowing the signs, who the team is. Start carrying that information with you when you're going to with your loved one. And if you're an individual that receives support and is in the system or has been, the biggest key for you is to be able to recognize your signs. And you're only going to do that by writing them down after you experience your first crisis. What was I feeling 30 days ago? What did occur? What were my loved ones telling me that they were seeing in me? What can I believe? What can I believe? X out whatever those situations are that you don't feel is right or appropriate. But everybody needs to be on the same page with those signs of what is happening during a crisis or prior to a crisis. So we can't forget the minute a crisis occurs, if you're a loved one, you begin that planning process of what's going to happen at the next crisis. What am I going to do? Who am I going to call? What's going to happen when I start seeing the signs way before the crisis occurs? What am I going to do? Who am I going to call? And as an individual, you have to be part of the solution. You have to be part of the time and the space of being able to recognize that when your loved one or your support person is coming to you and saying, I see these signs again, and we agreed last time that when I see these signs, this is what we're going to do. We're going to pull in a team to try to help so you don't have to go through a crisis, so you don't have to go to the hospital again. Okay, so it's a team and it's a collaboration, and in a perfect world, it'll work just like that. But we know we don't live in a perfect world, but we try and we have to keep trying. So there are also some areas that will help you in creating a successful crisis plan. And remember, you should start thinking about that the moment the crisis occurs. Okay, we're going to get through this. I'm going to have to call crisis. And then what am I going to write down that has occurred so I can create a successful crisis plan? You may be handed a crisis plan from a crisis provider that you call. That is very skim. That is not going to include your personal experience. It's not going to include the pre-warning signs of a crisis occurring. So you want your crisis plan to be personalized and include everything that you have experienced as the individual that's going through the crisis and as a family member. Okay, so keep your records. Make sure that your crisis team on the phone, that you're indicating this is a previous situation, it's a reoccurring situation. If you need to use that information so they're tracking what's going on, or this is a new situation, this hasn't occurred before, I'm not sure what to do. And then follow up with those 3 key steps that we shared earlier with updating the care team, updating that PCP, updating those support coordinators. This occurred yesterday. My family member or I am in the hospital today. I want this on record. This needs to be on record. And what do you think getting this information on record does for the individual or for you as a family member? Does anybody have any ideas of what that might do?
Well, in my son's case, it creates a history so that people in the future can look at it, or that we can get him the correct treatment by gathering all these different parts. And I'm really big on making sure that they know what's going on.
And that's perfect. And it also validates the concerns. So often we find ourselves saying, Nicole is overeating. I need a care team to come out. And they're like, well, that's an eating issue. No, this is part of her mental health history. This is a sign of stress, and she is on her way to a crisis. Can you look at the history, please, and pull up my information that I've given you for the last year? And you'll see that this is behavior that is ongoing when she's stressed and unable to navigate situations. So it does create that history, just as you said, Candy. It also validates the pre-crisis behavior when they have a record of that information. As an individual, I know my signs. I know when I'm not doing well. I can see that until I get to a point where I'm no longer able to see my own behavior and I'm looking at everybody else's. Okay. So, as an individual with lived experience, there comes a point where I cannot see my own behavior. And what I mean by that is I'm not in touch with how I'm actually behaving. If I've destabilized to such a degree that my behavior is no longer healthy for me, I will not be able to get in touch with that. And that's where my support circle and my loved ones come in and begin the process of pulling in support. Mental illness can be managed. You can be in recovery. You can move through your journey. In a lot of cases, it doesn't go away. It doesn't just poof, heal, and go away overnight. And so, as an individual that still to this day, after 30 plus years in recovery, struggles with extreme anxiety and extreme depression, I still at moments have times where I begin to pull away. I begin to isolate. Those are my first indicators. I'm not doing okay. I'm feeling overwhelmed. I'm not sure, but I think I need to reach out for some help. That's my personal crisis plan. Okay. And so I check in with people who know me and know that I'm an extrovert, that I love people, that I'm a chatty Cathy, and I try to get support in that way. If I don't, and people all in my life don't hear from me for a few days, there's key people there that know something must be going on with Dawn. That's my responsibility as an individual that's in recovery. That's a key distinction between an individual who is not stabilized yet. Okay. There are individuals like myself that have been working on my diagnosis, my mental health for years and years and years. And there are people that may not be able to get there. And those people who can't get there, we are their voice. As family members, we stand in the gap. And so it is part of our love and support of those individuals that equip us to be able to stand in the gap and say, these are key behaviors. And if you look at the history and you look at the record, you will see what I'm saying. The second thing is appointments. This is the hardest thing for family members to track because some of our loved ones, like my daughter, may say, of course I'll go for treatment or an assessment or this appointment or that appointment. And between the time they make the appointment to the day of the appointment, something happens or nothing happens and they decide they don't want to keep that appointment. And so tracking the missed appointments is also one of those key signs, and that historical record. If you're aware and you're in the individual's life, one of the key components is saying, look, you've missed like 5 appointments. Is there something going on? I'm so worried about you. I'm scared. If you could have that conversation. If you're not the person that can have that conversation, then you should be with a provider that can. If you don't have a provider that can have that conversation, reach out to your OIFA office so that you can begin to partner with the Office of Individual and Family Affairs, and they can start helping you navigate putting those pieces in place. Okay, let's go to this last key area. Somebody? Hi, Susie. Yes,
Hi.
go ahead.
On activity with keeping up with their appointments and communication support. Okay, there's a part of me, and also what I've learned through other types of people who have counseled me, that when you're working with adult children I'm learning to differentiate between how much to track, how much to look into that activity of they keeping their appointments versus they need to learn that independent of keeping their appointments and all of those things. So I guess I'm hearing that actually it can be both. We can be in the background keeping the track of all of these kinds of things, yet encouraging them or, you know, giving them kudos when they keep their appointments, or if they're doing it and just going, hey, they're adult children, I am glad they're doing that, but not making too big of a deal about it because they're growing into independence and doing that. So it's probably both, just standing in the background, just kind of tracking, depending on whether it's severe mental illness or whether it's mental illness, let's grow, let's take care of this type of kind of a thing. So you just, I guess you have.
Spot on.
Okay.
Spot on. And I think part of the reason, and I think I said the standing in the gap, and I'm just, like I said, I'm just a very transparent person. I'm exhausted.
Yeah.
I'm exhausted with navigating my daughter's journey.
Yeah.
I'm tired, and I feel sometimes like nobody gets that. You know, I feel like I'm the only one standing on a mountaintop saying, hey, you know, I can't do this anymore. And so the last thing I want to do, honestly, the last thing I want to do is have to call everybody, write everything down. Okay. There are moments where I just want to crawl under my blanket and just say, please go away. Can the world just stop for 30 minutes? My daughter is deaf, as I said, and so she has a video phone, and she uses that for her appointments when it works. When it doesn't work, guess who's her interpreter? Guess who's her, you know, phone person? I am. And so there are moments when I can pull back and just stand in that gap and kind of watch and oversee. And then there are moments when I have to jump forward and take the reins because I'm just not going to let her die. I'm just not going to let her fall through the gaps. I'm just not going to let that happen. And so there's a role that I have, and the role for me as a family member is to know when to take step back and just watch from a bird's eye point of view and trust when they have a good team and they have individuals and they're making appointments and they're doing all that. I'm watching with one eye the behavior and all of that. And then, you know, I'm back a little bit. I could take care of Dawn. I can take care of things that I need to take care of.
Yes.
I say this on a call, Susie, to everybody, and family members most often get very, very mad at me. But I want to say this on this call. Our biggest resource is a provider. And family members are so frustrated on so many different levels with providers. But I always tell everyone I work with, how can we make this relationship better with the provider that's serving your loved one? Because it's essential for growth for your loved one that you work with your providers. And if they're not doing what they're supposed to be doing and things are really egregious and awful, then we need to try to help you find a different provider. Okay. And that's not always an option. Sometimes, you know, there's just no other provider. Then in that case, we have to become partners. And part of that partnership is creating that relationship with the provider that's serving your loved one so you can step back and stand in the gap a little bit. In a perfect world. Yes, Candy.
Carol has her hand up.
Okay.
Hi, I have a 13-year-old son with bipolar, and I really liked how you mentioned, you know, having the provider that is there and is a huge part of your plan, we were able to switch his medicine up and do the test to find out which medicines work best for him, and it actually is working. We're having success right now. Where he first time ever, he said, I was happy today, which was
Oh.
unusual. But my question is like, he's 13, so we make him do his appointments. We make him,
Sure.
so I think my question is how can you encourage that when he gets to that age where he says, I don't want to do it?
Yeah, it will happen. Almost over 90% of individuals that do receive services get to a point where they change their mind. They don't feel like they need the help anymore. And the pre-work is what's really important, Carol. So not only establishing that good team where he feels valued. So the CFT model, part of the CFT fidelity is that individual that's being served has a voice. So some key successes of being able to keep individuals that are transition aged in the system until adulthood and success is right at that CFT around your son's age, is helping him drive that meeting, because that is his meeting. And so I always work with family members of young children and teenagers when they're at a point, they're the individual that's receiving services. They're the ones that really know how they feel. They may not know all of the systematic, programs that they need or how to work with the team. That's what you're there for. But the biggest point of keeping them in that mental health recovery through transition aged youth, is for them to run the meeting. How do you feel? What do you want? And at 13, they know what they want. They just don't know how to get there. And maybe they want more friends in getting services. Maybe they want an agency that's more youth friendly, those type of things. And then it's, of course, navigating all those pieces. But that's, Carol, I feel like that's key for young people today. So
Thank
I
you.
really wish you the best of luck.
Thank
And
you.
also get into a family run if you're not up, in one. I know family involvement centers up there. If you're in that area, get into NAMI, build your community resources so that you get all the support that you need. Okay. Thanks for
Thank you.
asking
That's
that.
what ended me and NAMI, being
Oh,
a part of
good.
NAMI was for that reason, because I felt alone out here, but
Yeah.
thank you.
You're so welcome.
Dawn, can you
Yeah.
use the acronym CFT?
Children's Child and Family Team Meetings. Sorry about that.
No,
We
that's
live in a world of acronyms at United Healthcare. But yeah, your child and family team meetings should be driven by the child, if capable, if of that age, if not the family member initially. And then the fidelity model, if you go on to Access's webpage and you type in CFT fidelity or CFT model, all of you can go in there and learn more about that model. And then they have adult recovery teams, and those are called ART meetings, just like, painting and art. They're the acronym for adult recovery meetings. And I just found out last week that one individual that's actually worked in the system with me for years and years and years had no idea that there were ART meetings. So if your adult loved one does not have an ART meeting, it's time to call that provider up and say, I want an adult recovery team meeting once a month. And I mean, you have to talk to the member. They really drive that. If they're willing to attend a meeting like that, the benefits to them will be driving their own care, working within the system to drive their own care. The benefits for the family who supports that loved one, if they're not able to drive their own care, and if they will go to a meeting like that, is that your voice. You guys are the subject matter experts, and I tell people that all the time. Whether you're like me as an individual that's received services, or you're a family member, or you're both like me, the most important thing is to know, one, the crisis, the aftercare begins immediately at the time of the crisis. Two, document history, write all of the information that you can down. I'm not a big writer, I type, but know your signs of your loved ones. Get out there, get to know your community resources, become a part of that community if you can. Support for individuals, OIFA offices everywhere support individuals because we all have lived experience. And we support family members because we're family members too. So get connected with your OIFA offices, get to know what they do and how they do it at your health plan. And also remember, the key to success is not trying to force success. It has to be acceptance of what you could do in the moment when you can do it.
So I wanted, some of the things that you mentioned, I wanted to say, my son has been in the Arizona system for 18 years now. And it's taken a long time to build a relationship with a care manager and for him to build a relationship with a care manager. And the care manager actually, with COVID, realized that meeting him at his home was the key. Now, he won't let her in, but he'll meet with her on the property. And we went from dragging him every 3 months to him meeting with her every 2 weeks. And now another person on the team is coming once a month. So building that relationship quietly, carefully. I've taken care managers to lunch. I've brought them food on their birthdays. I've done all sorts of things to try to build that relationship so that they trust me as well. But it does make a world of difference.
Yeah, it's so important. As advocates, sometimes we feel like we got to run in there and kick down the walls, and sometimes we do. Sometimes we have to take that role of, really, lion or lioness, but we have organizations that can help us with that too. NAMI and other, family runs and peer runs, that are around. But I had an individual who would only meet with his care manager at a Circle K. But can you imagine how inventive they had to be to even find that out in the first place? Because how many missed appointments? How many crises occurred? I see that Miss Eddie Sissons is on the call. I always say your name wrong first, Eddie. But I wanted to say hi to you, and I wanted to know if you are still having advocacy training.
Dawn, this is Lori, because Eddie seems to be having a hard time. Advocacy training, I can speak a little bit to that because the Arizona Peer and Family Coalition does do advocacy training. And if you go to the Arizona Peer and Family Coalition website, you can look on the one of the pages, and it describes the different levels of the trainings and what they are. We've got 2 4-hour trainings, and then we have a condensed training so that we can provide this to anybody. It's still all by Zoom, and so I encourage people to take a look at that.
That's awesome.
We have a mentorship where some of the people on the advocacy committee are spending time individually with members to further their learning and experience, enhance it with being an advocate, how to work with legislators and be an advocate on the level of state government.
That's great. I know Eddie also put some information in the chat. Why I asked that is advocacy, learning how, from my point of view, learning, yes, okay, Okay, so Lori and Eddie are filling up your chats if you can get that information. Advocacy is exactly what Candy was saying. So she's so smart about it. She's building relationship. She's taking in little treats and building relationship, and then that care manager goes, and then another one comes in, and then she's got to start again the whole process, probably 10 or more times. However, that advocacy really begins with relationship. But what Eddie will tell you and Lori will tell you is that you also have to be trained. You have to take a training to know the ins and the outs of the system, or you're going to learn the hard way, like Candy and myself and others have had to do when it comes to advocating for yourself or your loved ones.
Okay, but go ahead, George.
Well, thank you. I just wanted to mention that Access is doing a training upcoming on Know Your Rights. So that should be Zoom and free very soon.
I want to thank you for how you wove your own story in with the points that you were making, because I know it's very personal. Most of the people in this meeting have family members, have used crisis, have had a lot of challenges, and the learning curve is it's tough on everybody. And with what you've presented, it makes it easier for the loved one when the family members and the treatment teams, when everybody's on the same page. Something else that some people do know about is the Wellness Recovery Action Plan that Mary Ellen Copeland put together. And that's something that is taught in some of the clinics for members, and it takes them through their learning of what are their warning signs and who do they want in their crisis, and who do they not want. So it's a very proactive way of the loved ones dealing with this, and bringing in family members also. I'm wondering if anybody else has a story that you'd like to share, or a question that you might have for Dawn.
Well, and I wanted to say, and everybody on this call, I think, knows that my journey has been an extremely long journey with my son. And that I learned to start documenting when he's going into a crisis. My son I don't think has ever been in recovery, but still he does have these cycles. And trying to pinpoint a going into a major cycle is something that I'm going to start doing. I know it happens in spring now, but I need to know if I could just kind of pre-do that. So I really appreciate thinking about that. And for people whose loved ones are in recovery, it's probably more pronounced than in my situation.
But what I wanted to ask Dawn, when we had this same meeting and Northern and Southern Arizona presented, they had a worksheet for the end of a crisis event.
Mm-hmm.
And what I was hoping to hear about, if you spoke to it, I'll watch it on YouTube, is does that worksheet then fall into what to do after a mental health crisis? So they've got an end. Yeah. Thank you.
Yeah, sometimes, George, thank you for asking the question. I put a question in the chat for everyone too. But I think sometimes it depends on the crisis team that does respond. So I always recommend creating your own as an individual and educating your loved ones about that. And early in the presentation, I spoke about that. I spoke about, having the individual have their own, like, what happens after, what are my signs, who do I feel comfortable in knowing what I'm going through, and then the family creating theirs and working together as a team. But George, to really get into your answer, I received when my daughter had a crisis last month, she actually ended up in the ER because we found out that she had ingested a whole bunch of her medication. And so we had to call first responders. And in the ER, the crisis team came in. Well, I was asked to wait in the hallway. They came in and they talked with her, and they sent the doctor a crisis packet type thing, and he printed it out for us. And what we received was a 2-page document that said, you know, follow up with this organization for aftercare, and also, you know, use your tools that we talked about, which is taking a bath or talking to your mom or friend, whatever. But there was no real, it was very kind of flimsy in a sense. I mean, it's good because they're trying to do the best they can. I'm not into bashing anybody, you know, I'm not tearing down people. But what I'm trying to say is that there's no information like the information that comes from the individual and then comes from their loved ones in their lives. There's no better information to create a plan from that perspective. So the crisis team can give you that outline that you were talking about, and we can use that. And Candy, I'll send you one that maybe you could send out in an email that people can use as an outline. But remember that the individual that's experiencing a crisis is the subject matter experts, and so are you as their loved ones. Thank you, Ralph, for answering my question in the chat. I appreciate it. So I'm going to go back on mute. Hopefully we'll have some more
Okay.
dialogue.
From the perspective of an advocate, I think it would be wonderful if the new statewide trauma call-in center and the service providers offered a health and safety plan to everyone who's going through crisis, whom they contact. Not just a phone call, but I mean an actual contact. This health and safety plan was really spoken high of by Solari. Did I get that right? And you have a very good point, Don, about our knowledge. But I would also say as an advocate that if you have trouble with the providers, there are what they call natural supports. Churches, drop-in centers, peer and family things. So thank you all for listening.
Last month when Amanda Stamps spoke about the police response to a mental health crisis, what really I took from that was you never want the police to be the responder. That isn't what you want. And how important it is that you call a crisis team. So having that number in your phone, my sister happens to be on this call and she reminded me recently, when she moved here, the first thing I did is said, get out your phone. We're putting the crisis line in your phone in case I ever need it for my son, or you recognize it in my son. This is who you call. You call this crisis number. And oh, she's showing her phone. Yes, the Yavapai crisis number is in there. And so I think that's important to remember. And if you can get the crisis early, like you're saying, you're looking at the warning signs, then we won't need the police, who are not the best response to a mental health crisis. They are necessary at many times, but they're not the best response.
Yeah, suffice it to say they're better in some communities than others.
But I'm not sure if Amanda got into this with you folks, but if your loved one and you're calling on their behalf, if there is aggressive behavior and you say that, because that is, you're right, Candy, that is the last thing we want is police intervention. We do not want that. That had occurred in my daughter's last crisis, and I was, so what will occur is if you're on the phone and you're upset, I mean, your loved one is there, something's really bad that's happening, and you want to help and you want to, support, and things are all escalated, everybody's escalated, and you say to the crisis line worker, my family member, he or she's getting very aggressive right now. At that point, everything stops and there's a pivot. From the crisis worker's point of view, they're calling 911. And the crisis team, depending where you are, but most often that crisis team will hang back until the police show up and evaluate that individual and say, okay, it's cool, you could come over and begin your crisis intervention, which will really stigmatize your loved one in some ways, because if they're really not being aggressive, if there's not a history of violence, they will kind of put that information into the medical record, and that could stay with your loved one. However, please hear me. I need to qualify this. If you are a loved one and the individual who you love is aggressive and is physically threatening you, I encourage you to let that crisis worker know, regardless of the police intervention, because we all have to be safe. And I know when I am not well, I don't get physically aggressive, but if I did, I would want my loved ones safe from me. Okay.
Ralph?
Yeah, you're raising very good points that relate to this 988 system that's rolling towards us here in July. And what Amanda was talking about last week is also very relevant in that. I think we have a lot of work to do to implement the 988 system. I know I've got some meetings scheduled this week up here in the mountain with folks that were previously public safety and fire to talk about that part of it. I'm also meeting with the CEO of our provider, Jeff Oakes, over at ChangePoint. Same subject, trying to be prepared for providing a path for Solari to divert it towards, mental health rather than towards public safety. I think your points are very well made, though, with regard to the possibility of danger to self and others.
Just an FYI, Ralph, when the 988 rolls out, the local crisis numbers that everyone is still using statewide will not go away.
Right. I understand.
Yeah, but the 988 is going to be good because it's going to make it easier for a lot of people, and then if you travel throughout the state. Again, Dawn, thank you so much. And safety first. When the police need to be involved, they need to be involved. If there's a danger to self, a danger to others, we need and want that involvement.
But an example of a recent call from Apache County, woman's call, a mother usually, and she's calling about the adult son, and one of these situations where he was in probably one of his episodes, and he has a girlfriend, and the girlfriend was freaked out. Police arrived. It's a mental health crisis, and he gets arrested. It's just pitiful.
Those are hard situations. And knowing the crisis number and calling the crisis team is a great way to remind everybody that that's where hopefully these calls start.
And and something that we learned that for those of you that have had mental health first aid, it's better to have your loved one be upset with you for calling the clinic when you have a concern, or calling crisis, making a call. A friend, a loved one, don't be concerned about getting them upset with you. If it's a crisis, it's a crisis, and you're not the one to handle it. You need to use the resources.
So thank you so much for joining us, and we will see you again in June.
Have a great day, and thank you again, Dawn.